Hi viewers, this is Dr. Iftikhar Aslam from Pakistan. Today I'm going to present my lecture on echinococcosis, which causes the disease called as echinococcosis, or in other words, we also call it as hydatidosis or hydatid disease. In today's lecture, we will cover the information regarding the organism that causes echinococcosis and its epidemiology. We will also talk about the history of the disease, how it is transmitted, species it affects, and clinical and necropsy signs observed. Finally, we'll address the prevention and control measures as well as the actions to take if echinococcosis is suspected. Echinococcosis is caused by several species of Echinococcus, tiny cystoid parasites in the family Ctenidae. Currently recognized species include Echinococcus granulosus, Echinococcus multilocularis, Echinococcus vogeli, Echinococcus oligarthrus, and Echinococcus shiguicus. Echinococcosis species have an indirect life cycle and must develop in both an intermediate and definitive host. In many cases, the parasite cycles through specific predators or scavengers and their prey. Definitive hosts become infected when they ingest the cysts in the tissues of the intermediate host. The cysts develop into tapeworms which mature in the host's small intestine. Under the ideal conditions, the eggs remain viable for several weeks or months in pastures or gardens or on fomites. They survive best under the moist conditions and in moderate temperatures. The intermediate hosts include a large number of domesticated wild animals, particularly herbivores. If an intermediate host ingests the eggs, the larvae are released, penetrate the intestinal wall, and are carried in blood or lymph to the target organs. The incubation period for echinococcosis varies from months to years. It can be as long as 20 to 30 years if the cyst grows slowly and is not in a critical location. This kind of symptoms of echinococcosis depend on the size, number, and the location of the metacystodes. Until the cysts become large enough to damage the adjacent tissues and organs, they are usually asymptomatic. The clinical signs are those of mass lesion. Echinococcosis species are usually carried asymptomatically in their definitive host. Large numbers of parasites may be able to cause enteritis and diarrhea, but this seems to be rare. Thousands of adult parasites have been found in the asymptomatic dogs and foxes. There is a little information on natural infections with Echinococcosis granulosus in domestic animals. The cysts grow slowly and are usually asymptomatic until they are large enough to put pressure on adjacent tissues and organs. Livestock are often slaughtered before this occurs. If the clinical signs are seen, they are those of the mass lesions and vary with the organs affected. Most cysts are found in the liver and lungs, but they may also occur in many other organs. There are no lesions in the definitive host. Adult echinococcosis tapeworms are tiny, usually vary from 1.2 millimeter to 7 millimeter in length, and are attached to the small intestine. Most species have five or fewer segments, although some individual specimens may have up to seven. In the intermediate host, the cysts are always grossly apparent in tissues at necropsy. Echinococcosis granulosus Metacystodes are usually individual fluid-filled cysts surrounded by a fibrinous wall. Most cysts are 1 to 7 centimeter in diameter but can become much bigger. Although most cysts occur in the liver, some may be found in the lungs only, or even less often in other internal organs, including the bones. Echinococcus multilocularis metacystodes occur initially in the liver, but they can metastasize to other organs, particularly in the lungs and the central nervous system. These multilocular cysts have a semi-solid matrix and resemble the malignant tumors. They may be firm and lobulated or contain viscous fluid and can contain many scattered transparent cysts of a few millimeters to centimeter in diameter. The infected dogs and cats cannot be identified by the routine fecal testing. Echinococcus eggs are morphologically indistinguishable from Taenia species, and they are tiny proglottids and are rarely noticed in the feces. ELISAs that detect the Echinococcus antigens in the fecal samples can be used to screen the definitive host. This assay can detect both pre-patent and patent infections. A PCR assay designed for fecal samples is mainly used to confirm the infection or to identify the eggs from the feces. In the definitive host, the Echinococcus species can be treated with the anthelmintic drugs praziquantel, which is effective against the both juvenile and adult Echinococcus parasites. Surgery is often the treatment of choice. The long-term anthelmintic treatment may also suppress some cysts. Long-term daily albendazole treatment after the surgical resection of the cyst masses have suppressed the parasite growth in some dogs with the Echinococcus multilocularis cysts. Dogs may be treated with the anthelmintic agents before they are allowed to enter the echinococcus-free areas. Praziquantel is often used. One-time treatment is not adequate. Definitive hosts often become reinfected if they are re-exposed. The dogs that might be infected should not be allowed onto the pastures where the livestock may graze. In some countries, foxes have been treated with praziquantel in bait to decrease incidence of Echinococcus multilocularis and the risk to the other species. Eradication and control measures for Echinococcus granulosus sheep and dog cycle have been successful in some areas, particularly on the islands such as Iceland, New Zealand, and Tasmania. Well, this is the end of our today's lecture. Thank you so much.